Johns Hopkins Hospital will pay $190 million to more than 8,000 women and girls. They were patients of a gynecologist. He secretly photographed and videotaped them in the exam room.
Police found more than 1,300 pictures and videos on Dr. Nikita Levy's computer. He killed himself shortly after the investigation began early last year. A lawyer for the plaintiff tells CBS This Morning many victims have been reluctant to come forward. The ones that have feel betrayed.
We have people who are sleepless, people who are not working in the workplace effectively, people who are not focused, people who need counseling from religious leaders, friends, and professionals. We have people who have had very difficult ongoing relationships with their spouses or significant others. And so it is very difficult to categorize or pigeonhole these damages. They have been very broad and run the gamut.
CBS News legal analyst Rikki Klieman is here. Good morning.
Good morning, Charlie.
How could this go on so long?
Well, one of the things that this doctor did was he acted in a very surreptitious manner. This is a person who used a pen camera. He used key fobs with cameras. So you're a patient, you're at Johns Hopkins, one of the great premier health service systems in the country. You have gynecological exams. Your doctor says to you, well, I think you have an infection, I think you have a problem, I think you better come back more often. So the patient is lulled into a false sense of security, not understanding that perhaps you should only be doing this once a year. One of the problems, however, is where is the oversight? What do we do as an institution as powerful and great as Johns Hopkins? What do we learn from this to have more oversight that this couldn't happen?
And not only that, the scope of this. Yes. I mean, the amount of time that it went on, over 12,000 potential victims. And this morning we learn minors, young girls, may have also been recorded.
We hear from the plaintiff's attorney that there may be 62 or at least certainly more than 60 minors. But be you a small child or a young woman or be you someone our age.
It's a violation.
Violation. Sure. You're in the position. You put your feet in those stirrups. Right. You are totally vulnerable. The idea that someone would film your private parts, would then store them on a hard drive or more than hard drives in his own computer, the fact that he didn't share them is not really even relevant. It's the fact that he took them, that he used them. So no wonder these women feel that all their trust is gone.
Rikki, he's a doctor. What is it? Why did he do it? Just to creep?
Well, I think that's the bottom line. This is a man
and the black guy for Johns Hopkins. How do you think that they handled this whole matter?
I have to say that Johns Hopkins really, in the end, handled this very well. If you're dealing with a media crisis, a PR crisis, that they decided to accept all responsibility. As soon as the woman who was the whistleblower came in, she said, I saw this guy with a pen, this doesn't look right. They went forward and they've settled it. I think for these plaintiffs, perhaps the sad thing for them is this man will never face justice in a court of law because he took the coward's way out, killed himself within 10 days of being accused.
And just quickly, doctors are required to have a female attendant there if requested, correct?
If requested, and that really is the remedy. Have someone in the room. If you're a person going for gynecological examination, get somebody in the room with you. If you think anything is going wrong, complain to the powers that be. Don't let things happen that make you uncomfortable.
Got it. Got it. Thank you, Rikki.